It's not uncommon you hear somebody in your flat has a chest pain and he collapsed. This is a classical heart attack. If he gives us time, the best way is to take to a nearby hospital where the facilities are available. Don't rush to some hospital good number of kilometers far away from that place. This is very important because the golden hour is the most important slogan what we want to keep in the public is that the golden hour is very important. Why? Because what happens exactly in this heart attack is the main blood vessel out of the three, one blood vessel usually gets blocked by a clot. How the clot comes there? Because already existing cholesterol is there. We call fibroathereoma or some calcium also, or which the clot forms. How the clot formed there? Because the block is there for some time. Stress, any stress, a journey stress, emotional stress, job stress. So something stress in the family or all this can create a clot forming on the block and it closes the blood vessel suddenly, then the area supplied by this blood vessel gets irritated. It starts crying, then the rhythm changes. This is called the primary ventricular fibrillation or ventricular tachycardia. That means within the 1 hour, that's why 25% of the people of heart attack, massive attack, still in spite of so many advancements, modern technology to treat this, 25% die, still cannot reach the hospital. This is the reason this is called primary VTR, VF. It takes them away immediately. That's why heart attacks to be attended to the nearest facility hospital. When you go to the hospital with a heart attack, there is a sufficient time to arrange things because the emergency room will take over and the cardiologist on duty will come and the staff in the cath lab. There are considerations of giving a drug which can dissolve the clot. This is very useful in peripheral centers where the cath lab facilities are not there. This can save their life. No doubt there are many varieties of thrombolytic drugs, but one of the cost effective things we can use in India. And in the cath lab, when you take to the cath lab, facility is there with the supporting staff, anesthetist and cardiologist. We take emergency angiogram. The emergency angiogram can be done through a groin or the radial route through the wrist, which shows which vessel is blocked. Then we usually counsel the family and all for this emergency procedure that we take out the clot with what is called thrombus aspiration. There are catheters which remove the clot immediately. Then the flow establishes. We give some drugs into the artery also, that is different. But after removing the clot, if the block is still tight, there will be a stent, whatever the good stent available will be deployed across the block and re-establishes the flow in the artery. Why this is very important is the heart muscle will not go into heart failure. So when the pumping function is 60%, comes down to below 35, then it's a big loss. Even the patient survives, the heart pumping will be less throughout life and quality of life will not be good. So two things happen in the golden hour is saving the life and saving the heart muscle for a quality of life. Both are important. This is acute heart attack. What we do? There are many techniques of removing the clot, but recently we got very advanced devices like a penumbra device, which is there in India also. We can remove the big clots with this device rather than the routine catheters. And also there's a laser technology which can remove the big clots. So these are the very latest advancements. Sometimes the heart attack patient doesn't come easily like that with a heart attack. He will come with complications. Like inside there's a wall leaking. There's a wall which allows blood to flow only one direction. It happens to leak in the backward direction. This complication can come, we call mitral regurgitation. And then we have to talk to the surgeon also. But surgical intervention in acute heart attacks is little less because the complication rates are high. And sometimes the muscle which is between the ventricles is called septum can rupture because of the massive heart attack, and it's a very dangerous condition. Most of the patients die and even with a very aggressive treatment, quite a few only survive with this cardiac rupture. This is a dangerous condition, and this after the pumping has come down, the patient with heart failure can be managed in the ICCU, but still the heart is irritable for 2 to 3 days. Maybe that time we'll keep in the ICCU, see that it doesn't have complications like dropping the blood pressure, any bleeding complication because of we give a lot of drugs which make the blood vessels, the blood cells thinner, so that this is called antiplatelets, and keep the clotting less. This is called anticoagulants. Their effects are very important, but at the same time we have to give in a proper dose, and that's why you keep them in a massive heart attack. 2 3 days ICU is important. Yes, some patients come with a massive heart attack at the drop in the blood pressure. The cardiac output is very less. All the organs get affected. So these patients can be saved by anesthetist making some intubation and a ventilatory care, and sometimes who put what is device called intra-aortic balloon pump. This is put through the groin to support the heart, to maintain the blood pressure, to maintain heart circulation. A very simple device. Every hospital, even districts, it is available nowadays. The next higher end device, like we have to have 5 liters of blood pumping in 1 minute. The higher devices are called impeller device. That is also available in India. Fortunately, we in Hyderabad deployed many impellers for a cardiogenic shock. Cardiogenic shock means blood pressure is low, cardiac output is low, and urine output is low, and all organs getting affected because of the massive pumping loss because of the attack. So this impeller can protect them 5 to 7 days until the patient comes out after the angioplasty. It can take care. This really made a remarkable improvement in the massive heart attack cases. This is a massive attack. There's no provision that you want to ship to the other hospital. What best you can do, your nearby standard bystander, what you can do. Immediate thing is you make them flat. Why it is important? The brain gets blood supply. The brain is dead. Whatever your efforts you do, you cannot do anything. That's why you see quite often the heart still pumping and rhythm is there, but the brain is dead. It's a very helpless situation. So keep them flat, and airway should be maintained. Keep the whatever the cloths make loose, the tie and all, make the airway free for. And important thing is when you suspect the patient has collapsed with a seizure-like activity with the eyeballs rolling up, you recognize this is a heart attack in the correct suitable patient who supposed to have the heart attack in that age group, whatever we should we can have a history, we don't have any history from anybody. What all the like the now the programs are there for police people, the general public, the schools. We are conducting many programs in NGOs and the government employees how to make up these CPR programs. Like 70 to 80 times, you keep your both hands with maintaining the pressure from the wrist to hand one by one near the sternum, between the sternum and the mammary area on the left side, and keep pressure thumping around 70 per minute. The main idea of this doing is the squeezing of the blood from the heart to out, then the heart fills again. When the heart fills again, there is a reaction that heart again starts to pump. So this sequential cycling will be maintained until his heart again picks up. There's a chance to give until he can be taken to a nearby hospital cardiac tertiary center. And at the same time, every fifth beat, the cardiac resuscitation should have one respiratory support by mouth to mouth breathing with a barrier in between. We can do that. So these things can save, and at the maximum what we give drugs may not give any emergency drugs there, but a disprin or a aspirin tablet 325 milligram chewable sometimes can help. You can give that if you can swallow it. And the best way is don't give nitrates, sorbitate. People think that sorbitate is tablet for heart attack. If you give that, the further the blood pressure may drop. So there is always better to avoid that type of things, and take the nearest without wasting time, save the golden hour. That's the attitude.